Welcome to the Ricci Flow Nutrition Podcast. My name is Cameron Borg. On this episode, I had the pleasure of speaking with Mike Belkowski. Mike is a doctor of physical therapy, podcaster, and CEO of red light therapy company Biolight. Dr. Belkowski integrates unique treatments such as dry needling, cupping, blood flow restriction training, hyperbaric oxygen therapy, and of course, red light therapy in his private outpatient practice in Montana. His popular podcast, The Red Light Report, is one of the best resources in the world on the topic of photobiomodulation, where Mike interviews experts and discusses the array of therapeutic applications of red and near-infrared light. I had a great conversation with Mike. I'm a huge fan of The Red Light Report and of red light therapy in general. Mike's work has been instrumental to my understanding of its therapeutic uses. Red light therapy is becoming much more widely used and recognized as the beneficial effects continue to be identified. Mike has vast experience working with patients, so he's uniquely informed about the beneficial effects of red light therapy in conjunction with the other therapies he uses in his clinic. To me, this makes him a primary resource on the topic of photobiomodulation. He's also very well versed in what it takes to make a good red light therapy device because he has been developing some of the best panels for years with his company Biolight. So with all that being said, I hope you enjoy the episode. Thank you so much for coming to speak with me today, Mike. I really appreciate it. I'm actually a huge fan of your podcast, and I found out about you through our mutual friend, Dr. Stillman, and you guys have had some awesome conversations about the benefits of red light as well. So I guess I was just wondering, where along the path for you did you discover red light therapy, and what did you think of it when you first came across it?
Yeah, first of all, thanks for having me on, Cameron. It's a pleasure. And I looked at your guest list, and it's got some pretty hefty people on there. You got Gerald Pollack and Dr. Michael Hamblin. So you've got some heavy hitters on your podcast. So congrats on that.
Thank you.
But to answer your question, my origin story, so to speak, with red light therapy. So I'm a physical therapist by trade, or a physiotherapist for you guys, I think. And it's actually a funny story, kind of a sidetrack here. When I was graduating PT school, my full intention was to work for a year or two in the States locally where I live, garner some experience, and then move to Australia for a couple of years and work there, just because Australia is kind of the mecca for physiotherapy and physiotherapy research. So it's a good place to work, especially as a young graduate. But at my first job locally, I met my now wife, and I never made it down to Australia. So it's still on my to-do list, but a pretty good excuse for not making it down.
Very good excuse, yeah.
But anyway, back to the red light therapy question. Yeah, so I'm a physical therapist by trade, and when I took that first job where I met my wife, the way I was utilized, and really the way physical therapists are utilized in the United States in this allopathic system, which is very much so directed, or how you treat patients is dictated a lot by the insurance companies. And so what I mean by that is they'll reimburse for certain treatments, while I think I can use this other treatment that'll get the patient better, but the insurance companies might not reimburse it as well, if at all. And so your clinic owner is going to want you to do these other treatments that reimburse more, of course, to keep the doors open and cash flow and all that stuff. So anyway, again, that's just part of the equation. But long story short, I didn't like how it was being utilized. I didn't like the quote unquote system. So I decided I'm not going to be dictated by insurances. I'm going to start my own cash-based physical therapy practice. And so by being a cash-based PT, which is kind of risky, so to speak, or it was, especially when I started, people have to pay full cash. There's no insurance, obviously. But the point being, I get to treat patients how I want to. I can start utilizing these treatments that maybe insurances don't reimburse at all, but I believe, and the research shows, they're more effective. So for example, treatments I started utilizing right away and I became well known for in my area was dry needling, which was the big one. I'm not sure if you're familiar with that, Cameron, as far as being able to reduce pain of all sorts and types, meaning people could walk in with acute pain. They just twisted their ankle or sprained their knee or something, and maybe they had a balloon for an ankle or knee, and within one session I can decrease that almost back to normal. Or people walking in with chronic lower back pain or chronic headaches and migraines, and easily within 1 to 2, maybe 3 sessions, I can get their pain darn near down to zero. Whereas traditional PT is like, come see me 2 to 3 times a week, 6 to 8 weeks, and hopefully we get you better. But it was along this path of finding these holistic or alternative treatment therapies that I came upon red light therapy, because as being a cash-based PT, you have to kind of, especially with where I'm from in Missoula, Montana, which I'm sure you guys don't know about in Australia, but it's a state in the U.S., and it's just a very PT dense city, meaning there's a lot of PTs there. So you kind of have to have something unique to bring people towards you. And so that's why I started getting into these holistic treatments, not for the sake of being different, but again, finding treatments that are more effective, more efficient, and going to improve my patient's health and pain quicker and more effectively. So again, dry needling, I started utilizing cupping, blood flow restriction training, hyperbaric oxygen, and really I'm picking up these treatments well before the curve or well before the trend. Whereas some of these treatments are more common today in 2022, they weren't so much back in 2016, 2017. And again, it was along this path of learning about these treatment techniques that I came upon red light therapy. Up to that point, I didn't really give light a second thought other than it's brighter when the sun's out, it's darker when the sun's down, and I can flip the switch to brighten my house when it's darker at night. That was about it. I didn't really consider it and how it impacted my health. And so I'd heard about red light therapy because I listened to Ben Greenfield, another biohacking podcast, pretty consistently back in those times. And so I'd heard about photobiomodulation, but again, didn't really think about much of it other than it's this red light that kind of looks cool, but like it's light. What could it possibly do? But again, reading all these books, of course, Amazon suggests or recommends certain books, and this one kept popping up that had 5 stars and a ton of reviews. So it's like, I can't ignore it much longer. I got to at least read it if it's this popular and this well reviewed. And it's I'm not sure if you've read it, Cameron. It's this. I'm trying to pull the book here, the one by Ari Whitten.
Ari Whitten, yeah.
So I mean, this is probably the one most people would turn to, and probably thanks to Amazon. It was written, gosh, 2018 is the copyright. So yeah, right around the time I started getting curious about it. Yeah, so I got that book actually late 2018, and I founded Biolight 2019, early 2019. Right. But so I read the book. I got the book and I read it, and right away. So the first quarter of the book or so is about the mechanisms of action of how red light therapy works, and right away it resonated with me because, again, with me being an expert in dry needling and knowing that basically some of the main mechanisms of dry needling is reducing inflammation and improving circulation. And that's how you can reduce a lot of types of pain, musculoskeletal pain in the body. And so those are two of the main mechanisms of action. And of course, and your audience knows with red light therapy. So I'm like, aha. I mean, if red light therapy does this, I already know what dry needling does for reducing pain. So I'm already kind of bought in here. And then the cherry on top is red and near infrared light's ability to optimize or augment mitochondrial health. And the more I dug into mitochondrial health, after reading that, it's like, holy cow, this is like, why don't more people know about this? Why aren't more people utilizing this? And of course, again, that was back in late 2018. And even back then, well, I shouldn't say that. I was saying it was kind of popular back then, but it really wasn't, and it still isn't. It's surely more popular now, 4 years later, and it's getting much more exposure through influencers and people like you and me having podcasts talking about it. So it's slowly growing, but I still think it's very much in its younger stages of getting mass adoption or mass exposure. But anyway, so the first quarter of the book had the mechanisms of action, and I was bought in right away to that point. And then the subsequent 3/4 of the book or so is all the research and how it can help with skin health and hair health, thyroid health, athletic performance, and sleep. And it's like, what can it help with? But then again, when you go back and realize that one of the main things it's treating, or not treating, but helping with, is mitochondrial health. And mitochondria are everywhere in every single cell of your body outside of red blood cells. It's like, well, shoot, that makes sense, because from the outside looking in, when you hear that it can treat so many different things, it does start to sound like a snake oil pitch. But again, when you read or listen to someone like we're talking here talk about it, and how if it's impacting mitochondrial health and it's everywhere, then it truly does have the potential to help with a vast majority of modern illnesses and modern diseases. So that was a long-winded way of, that was my catalyst, was building my cash-based PT practice, came upon the book, fell in love with the book and the mechanisms of action and the research, looked at what the market had to offer. And at that time, it was either like really, really expensive devices that it's like, I don't know if they really necessitate or uh, deserve the price point. But regardless, on the other side of the spectrum, you also have the extremely cheap products, and thus you're probably getting pretty cheap results. You kind of get what you pay for to a certain degree, but regardless. So it seemed like there was, well, and on top of that, there was a relative dearth of education for the masses, or education for the layperson. Back then, it seemed like everyone was touting that you should just use red light therapy for 20 to 30 minutes every single day. And while that's probably better than nothing, if you're trying to get specific results, and I'm not sure how familiar you are with the research, Cameron, but if you look into the research or you read the research, you quickly understand that there are fine tunings you have to do if you're trying to treat wound healing, or if you're trying to improve thyroid health, or if you're trying to improve gut health or brain. Like it does necessitate slightly and sometimes drastically different protocols. So I could tell right away that the education curve was going to have to be improved as well for the mass adoption, or the mass people, to not only understand how it could benefit them, but understand, if they were to get a device, how they're supposed to use it. Because while shining light on yourself is a relatively easy treatment, again, there are some nuances as far as, should I use red and or near infrared? What's the duration of the treatment to get optimal results? How many times per week? And again, if you go back to the mantra of 2018, where most people are saying 20 to 30 minutes every single day, I would argue that that is leading towards the side heavily of over-treating. And while over-treating with red light therapy doesn't necessarily lead to negative or harmful consequences, which I think is one of the beautiful parts of red light therapy, it would lead to a person not getting the results they're looking for. So, and I know I'm kind of going down a lot of rabbit holes here, and if you let me go, I might go for another 60 minutes here. But if we turn to the biphasic dose response, where it's that bell curve, we want to get those treatments right underneath that bell curve in that middle section there. If the dosage is too low, you're going to be on the far left of that bell curve. If you overtreat or the dosage is too high, you're going to be on the far right of that curve. And I think based on and again, this is kind of back to the 2018, 2019 era of when I started to get into red light therapy. Most people touting that 20 to 30 minutes, that's on the far right of that bell curve. And we also, I think it's easy to get into this mentality where it's like, I used the light for 5 minutes and got sweet results. So maybe if I use it twice a day for 10 minutes each every day, maybe I'll get better. So it's easy to get into this mindset of more is better. And so I kind of harp on, both in my ebook and in my podcast, and when I'm just answering people's questions, that more is not always better. And in fact, you might get better results by decreasing your dosage, or by not using it every day. Because just like exercise, if you over exercise, you're actually it's going to be a denigration to your health to a certain degree. You need to allow your body and your cells to adapt to the stress, which light is a stress. So I could keep going on, but I'll hand
Yeah,
the
yeah.
mic over
Look,
to you, Cameron.
I could probably just let you go on, because you've touched on so many things there that I already wanted to speak with you about. But I guess like going back to this idea that, when people ask you what does it do, and you have to sit there and think, well, kind of what doesn't it do? It does sort of feel like this snake oil pitch, where it's this almost this, it kind of affects everything in a way. But I've been thinking, well, the reason that red light and the wavelengths beyond the red that are invisible to us have such profound effects because we evolved exposed to them essentially all day, every day. Um, so it's probably not that far-fetched to think that they would have such enormous effects to all the systems of the body, because we were outside all day, and even on cloudy days, all that infrared light is coming through the clouds. And at night, we'd sit by a fire and then go to sleep. So it's probably um, not that crazy to think that this photobiomodulation can affect all of those things at the same time. I guess I'll just go right into it and sort of compare it to sunlight. In your view, how does red light therapy, the use of these red light devices, compare to using the sun to get doses of red and near infrared light?
How do they compare as
Yeah,
far as what is a person trying to do, like general health and wellness?
yeah. I
Or
mean, like, if you're outside, if you're getting sunlight on a very regular basis, is that a continual low dose, red light therapy in a sense?
well, I guess it depends on what time of the day people are getting outside, because of course it's going to be most red, or the ratio of red is highest first thing in the morning. And so that's why, thanks to Dr. Jack Cruz, are you familiar with him, Cameron? I'm sure.
Definitely,
Yeah,
yeah.
yeah. So thanks to him, I've been doing my morning sunlight, watching that the sun rise for how many years now? Coming up on 4, or is it 3? Either way, thanks to him, I'm doing that.
Hmm.
So to answer your question, it's like if people are outside more so during the middle of the day, well, that's going to be a lot of UV irradiation, and we have to be somewhat concerned with that and its potential impact on skin health, or the detriment to skin health. But as of course, as Dr. Jack Cruz would say, the more you expose yourself on a consistent basis, the longer you can be outside without having those negative consequences. But to answer your question, if a person is getting outside on a consistent basis, to your point, from an evolutionary perspective, that's what our cells are used to. We've completely flipped the script and, swung the pendulum to the complete opposite side, where not only are we indoors out of the sun, but we're compounding that issue by being surrounded by non-native light, such as fluorescent lights or blue lit technology with all these screens. So we're really doing a double whammy on our cells, but of course our circadian rhythm as well, because we love being surrounded by our screens, especially at night, which inhibits melatonin production and wrecks our ability to sleep. And of course, that alone wreaks enough havoc on a person's health. So to your point, just getting outside, just getting back to nature on a very consistent basis alone will be a boon for someone's health. The caveat to that is these devices have a much higher concentration of red and near infrared light. And if you look at the research, I mean, there's a heck of a lot of benefits that come from using these lasers or using these LEDs. So if you're trying to treat a specific issue, granted, if you look at some of the history back in the 1800s and early 1900s, using heliotherapy, where physicians are literally using the sunlight to heal people that are otherwise not responding to other treatments, you could certainly argue the sun is a massive healer. But again, if you look at other conditions, and I'm just thinking like thyroid health, gut health, and you treat the gut brain axis, and you can reduce Parkinson's disease via near infrared light or red light. It's like there's a time and place for both, for sure. And just to give another example, Cameron, because we're about to hit winter here in Montana, which is kind of doom and gloom, lots of clouds and not a lot of sun. So that's when I start ratcheting up my red light therapy usage on a consistent basis. Whereas during the late spring, early summer, where we get lots of sun and I'm outside much more often, I'm doing close to no red light therapy. There's a handful of treatments I like to do on a semi-consistent basis, regardless, such as treating my gut, treating my brain, treating my mouth, or using one of my Guardian devices to treat inside my oral cavity. But again, there is a seasonality to how I use red light therapy based on how much sun exposure I'm getting. In a perfect world, I think kind of using nature and using the technology we have, you can kind of blend it to get the best of both worlds. So I don't know if that necessarily answered the question, but always turn to nature first, and that's kind of something I've adopted from Jack Cruz. But again, I wouldn't completely turn my head away from red light therapy because I mean I've noticed too many good things for myself personally, for my pet, from my friends and family. It's like there's, and for my patients even, I've seen some crazy things happen, such as uh, chronic hives someone was dealing with for several decades. And that's why she was coming to see me. I was doing full body dry needling sessions, and that was the first thing in her life that had helped reduce her hives. Uh, Pharmaceuticals weren't working. They were just like upping dosages, or like polypharmacy where they're just switching different types of drugs to see what worked, but nothing really helped her. She's dealing with this for decades. So she came upon me for dry needling, and I would do my full body dry needling, which in my mind is reducing systemic inflammation, improving circulation throughout the whole body. And she would see me maybe once a month, once every 3 months, because that's how well it worked. I wouldn't have to see
Right.
her that often. But it also came to a point where and this is kind of in the middle of when I was building Biolight, so I didn't really push upon her red light therapy right away. But it came to this point where it's like I'm seeing her every 2 or 3 or 4 months, and it's like, geez, I think you should try this red light therapy thing. Like I didn't want to push it on her. Like it was kind of this odd situation of me having this company. I didn't want to like push my product on her, so to speak. But at some point I couldn't not tell her because of the research and the results people are getting with red light therapy. So long story short, she per my recommendation started utilizing, or she got herself a full body red light therapy panel, and right away her hives were just like gone basically after using it on a semi-consistent basis. And that's what I don't know what your thoughts are on this, Cameron, but when people are dealing with autoimmune issues, or where there's like a systemic issue, fibromyalgia, like in her case, hives, or RA, rheumatoid arthritis, all these autoimmune issues, Hashimoto's. I always say that I think, and I don't have research to back this. This is just my thought process. Doing full body is probably the best bang for your buck, because if it's autoimmune, it's all over your body. So if you can immerse your cells on a consistent basis with red and near infrared light, I think that's going to do your best. Versus, yeah, I think you can do really well by treating the thyroid directly, but I think doing full body, I think you may get better results. I don't know, but that was again another diatribe. I digress.
No, that's fantastic, and it's great to hear that results like that actually happen. And you know, with these autoimmune conditions, also with things like chronic fatigue syndrome,
Yeah.
where people are just really struggling to get any help whatsoever. Certainly, I think getting bathing the body in these wavelengths that appear to really give mitochondria what they need to actually start working again. I think in conditions like that, I mean, the evidence on rheumatoid arthritis seems one of the strongest in the literature as far as the use of red light therapy. Um, and you know, I've read it in books about people having, you know, absolutely incredible reductions in pain just based on short sessions. And that's another thing that, you know, you mentioned before, this dose response curve. It's not more is better. And something that I found quite interesting when speaking to Glenn Jeffrey, who's been working on macular degeneration and using red light to repair the retina, they use like 1 to 2 minutes once every few days. It's not like you need to stare into a red light for 20 minutes. It's this really tiny dose, and they're trying to work with near infrared wavelengths now, so you don't even see it.
Yeah, yeah, that's huge.
Yeah. So, you know, it is strange to think that sometimes less is more. Um, but I wanted to get into, because you have quite an intimate knowledge about what goes into making these devices. What are the particular wavelengths that are most beneficial, and why do those particular wavelengths work to produce the results that they do?
So pretty much everyone uses the same couple of wavelengths, red being 660 nanometers and near infrared being 850 nanometers. And then some people integrate multiple spectra of red and multiple spectra of near infrared. But I guess it all comes down to what the research has been showing as far as what wavelength gives the best bang for your buck for overall conditions. I think, of course, over the years, and as the research continues to come out, we're seeing that potentially certain organs or certain tissues are responding to a certain wavelength of red better than other tissues. Or, for example, let's say one responds to 620 and another responds to 625, or what have you. And same with near infrared. And on top of the wavelength difference, we're also seeing there could be a timing mechanism, which makes sense if we think about all the clocks that our cells and tissues have. If we look at the our circadian rhythm, and I think the most recent piece that I'm aware of was, like you spoke about with eye health. I think it came out about a year ago now, which is crazy because it feels like it still just came out. But the piece of research that showed, looking at red light, again, very low dosage to your point, and eyes and skin have some of the lowest dosages. And I harp on that when people are considering eye treatments. It's like these panels are relatively high powered. So either you need to be standing way back or consider getting a device that's much lower powered to make the treatment dosage more easier to attain versus blasting yourself with these high power devices. But anyway, going back to the timing issue, doing a one red light session in the morning led to a statistically significant increase in visual and color acuity for a week. Whereas doing that exact same treatment in the afternoon led to zero results. So we're seeing that there's some, as they put it in the research, like the mitochondria have shift work, or they work in shifts. So apparently the mitochondria in the eye respond to light much better in the morning versus not at all in the afternoon. And maybe that has something to do with watching the sunrise, and there's actually something to that. I don't know, but that's just what that piece of research showed, which I found pretty interesting. I'm trying to think of another one, timing wise. But to your point, I think one of the pieces of research I recently read had to do with, or it was a review, and they were reviewing near infrared light's impact on eye health. But to your point, I think that's a much more palatable treatment because you're not having to combat the abrasiveness of a potentially bright red light. If you could do near infrared, I think that's much easier to do.
Yeah, Glenn was talking about perhaps developing a strip of near infrared lights that you'd put on the top of your laptop so that when you opened it up in the morning, you'd get your minute or two and you wouldn't even notice that it was there. And yeah, the fascinating thing about the timing issue, because he and his group did those studies a few years ago and got no results. So they stopped looking. And then another group, I think somewhere else in the UK, repeated them but did it in the morning and got all these results. And that's when it twigged that time of day actually makes a huge difference. And the way he explained it to me was that when you wake up in the morning, your mitochondria are more likely to have a bit of extra energy, a bit of extra reserve capacity to do other things, like repairing and fortifying the cells against damage. Whereas at night, they're kind of worn out and they're not going to respond as well to the stimulus of red light. So yeah, the time of day thing is something that's I hope is more explored, because I think it could even bring about better results. And hopefully in the research they start to include more information about time of day exposure, because what they're talking about is with regard to exposing first thing in the morning makes sense, because that's when the ratio of red and near infrared light is highest in the sun. So evolutionarily it makes sense. And it's kind of good to know that you don't need to be strapping on a red light panel, for hours in a day
Right.
to get the right results. And I've even got like a pen light that has it has three LEDs in it, and it cuts off after 2 minutes. It just has an automatic cutoff timer. And at first it annoyed me because I was like, what if I wanted to use it for a longer time? But I'm coming to realize that you really don't need much, and to charge the mitochondria battery, which is kind of what these red lights are doing, they stay charged for a few days sometimes. So particularly if you're taking care of yourself. You probably don't need to do it all the time. Um,
Yep,
but
agreed. Well, Cameron, before you continue on, um, was this thought process of doing red light therapy in the morning specific to the eyes, or is it for the whole body that it's best for red light therapy treatments?
my guess would be that it has application elsewhere other than the eye, but I don't think that's been tested yet.
No.
I hope they keep looking into it. They'll probably keep doing all of their research as far as red light and eye health. They'll probably keep doing it in the morning now that they know. But as far as the other parts of the body, I see no reason why, if his hypothesis is correct, that mitochondria have more reserve capacity first thing in the morning. I have it seems logical to me that red light therapy first thing in the morning would give you your best bang for your buck. But
Regardless of what you're treating?
regardless of what you're treating, I mean, if it's got anything to do with the mitochondria, then it's possible that light first thing in the morning is the way to go. That's just my thought. If Glenn's hypothesis is correct, then that may be the case, but there may be other factors at play. I really don't know. Um,
Yeah, makes sense.
yeah, I just kind of makes sense to me, and it's probably not that hard to get a small dose of red light when you wake up in the morning. Particularly if you've got a full panel or something, you can just switch it on and stand in front of it for a few minutes, and then you're sort of charged up for the day, ready to go.
Yep.
Um, I don't know. Does that sort of make sense to you? I'm not sure if that's been explored in any other books. This timing issue.
No, I get that question a lot though. But it does make sense based on evolution. If our cells were outside, so to speak, that's where they would get their red light is in the morning. So there's probably some entrainment there over thousands or millions of years that they're getting their red light in the morning. So, uh, and a little bit at night too, I suppose, with the sunset. Same kind of thing with that ratio.
Mm,
Well, I don't know, but I agree with you. It makes sense based on that and the information we have with the eye now that they're basically non-responsive in the afternoon and onward.
yeah. I mean, it may be different because the retinal cells are the most energy demanding cells in the entire body. So maybe that's where you're going to see the most dramatic time of day difference. But yeah, again, I don't know. But on the other sort of end of the spectrum, I was speaking with one of Glenn's colleagues, and he was speaking about his hypothesis about why blue light is so damaging in the mitochondria. And his hypothesis is that there's this precursor to heme, because heme is made in the mitochondria, this precursor molecule called protoporphyrin that has a big peak in absorption in the blue range, so around 420 to 450 nanometers. And when it's hit by blue light, it creates singular oxygen. It's very, very damaging to the cell to be exposed to blue light. And his hypothesis is that our cells, our mitochondria, make heme at night, specifically because evolutionarily there was no blue light at night. So it was a very safe time to make heme. And now, we're sitting under, fluorescent tubes and cool LEDs at all hours of the night, exposing our skin to blue light that's potentially creating a lot of singular oxygen through this protoporphyrin. So that's just another sort of time of day thing regarding light, where the body seems to have curated specific activities for certain times of the day. And I think there's a good chance that he's right. And both he and Glenn have said that artificial light is the biggest public health issue that we're facing today, and I couldn't agree more. And I think red light and red light therapy has to be part of this conversation to um, not only balance the spectrum that we're exposed to throughout the day from artificial light, but also to repair the damage directly. So yeah, there's a lot going on in this field.
Yeah, that's the first time I've heard that hypothesis, but just hearing you, that makes total sense. As far as why blue light's damaging it, especially at night. And I always tell people red light therapy would not be such a big deal, or these gadgets and panels would not even be necessary to a large degree if we weren't dealing with this non-native light issue that you're speaking about. If we were outdoors like farmers basically all day most days, getting our sun, uh, getting our exercise outside, not in the gym under fluorescent lights, all of these things, eating food that's been irradiated by the sun. I mean, there's all these things that how sun affects us we might not even think about. But again, if we were doing all of those things like we were a couple hundred years ago, I mean, maybe you'd use red light therapy to heal a wound or to, uh, gosh, I don't know. Like that's how impactful light or sunlight is on a consistent basis. Like you and I spoke about at the top of this podcast. Um, Sunlight's basically the gold standard, right? And of course, red light therapy devices offer a higher concentration, and there's benefits there. But like we're discussing now, if we weren't cooped up inside, and if we weren't constantly surrounded by, Bluetooth and Wi-Fi and all these invisible forms of light that are bombarding our cells on a consistent basis, well, shoot, we wouldn't really need red light therapy to a large degree because our mitochondria would be humming along as they should be. So, yeah, red light therapy is basically a pretty cool technology that's helping us combat or to a certain degree mitigate the damage we're doing to ourselves with all this non-native light.
Yeah, look, yeah, I couldn't agree more. No, you're quite an expert in, the uses of red light for all these different sorts of issues. So I was wondering if we could just sort of go through each one and talk about maybe like a protocol that could be used and what the research says and why you think it might be working. Um, so red light therapy and neurodegeneration, things like Alzheimer's and Parkinson's disease. How is it working, and what sort of protocols have you seen work?
So a lot of those specifically, I haven't seen or use it like on myself or other people personally, but just like transcranial photobiomodulation.
Yeah.
Um, well, the nerves, since they're very energy demanding, are very mitochondrial dense. So it stands to it makes sense that if you can get red, or it'd have to be near infrared to penetrate that deep, if you can get near infrared light there, and can improve mitochondrial health and then improve the energy status of that cell or that tissue or that organ, well, then it should return or you know start heading back towards operating normally, whether it's a nerve or part of the tissue of the brain or what have you. And then there's that gut brain axis. I alluded to this a little bit ago, where
Mm.
just treating the gut can improve symptoms of Alzheimer's and Parkinson's, uh, and mood behavioral disorders such as depression or stress, what have you, just by treating the gut because of that gut brain axis. And that's I think I said this really quickly, but that's one of the treatments I do on a semi-consistent basis, is just irradiating my stomach or my gut with near infrared light, both to optimize my gut microbiome, but then secondly to tap into that gut brain axis and just help with anything upstairs in my brain, brain health wise. um and then I guess, if I know you're talking neurodegenerative diseases, but also looking at concussions, which is quickly coming
Yes.
onto the scene with, especially here with American football, and just soccer is a big one for concussions, but sports in general, concussions galore. um and there's some really cool research with concussions and how red light therapy can mitigate or kind of accelerate the recovery process. Because one of the worst things that happens with a concussion is that you're much more susceptible to getting another one until it's fully healed. So if you can decrease the recovery time, then you can hopefully mitigate or prevent uh, a subsequent bonk on the head or what have you from uh, making things even worse. Because once you get that second concussion or that third concussion in a close time period, then things actually get worse and worse exponentially, and it's tougher to recover. So that's a big area of red light therapy I'm excited about. And I think there's a time in the future where the sports world's going to have to adopt some type of a device where someone gets bonked on the head, they're laying there on the field, and they're going to be walking off the field with something on their head, like a red light therapy device, just to begin that process of the healing process with near infrared light. And to kind of tap or to echo your sentiment about how the eye and the retinal nerves are so energy intensive and thus mitochondrial dense. When we talk about neurodegeneration, or if we look at any disease process that comes on somewhat early in life, and what I mean by that is like 50s, 60s, 70s, where we have our vision's going down, our mental status is declining, heart conditions, cardiovascular issues are a big deal. Well, the thing that links all those together is that they're very energy intensive. And by that I mean, if you begin having a low energy status in your cells, meaning dysfunctional mitochondria, the first places those are going to show up is where the mitochondria are most dense. So where they're the most dense, they're also prey to degenerating the quickest, that cell or that tissue or that organ. So again, that would be the eyes, that would be the brain, that would be the heart, liver and skeletal muscle. These are the areas that are going to fall quickest and hardest if you have dysfunctional mitochondria. And you're going to have dysfunctional mitochondria if you're not exposing your body to proper light nutrition on a consistent basis. So when I'm thinking about neurodegenerative diseases, like we're talking about the brain, Parkinson's and Alzheimer's and MS and that kind of stuff, um, that's as Dr. Doug Wallace would say, that's directly affected or secondary to mitochondrial dysfunction. And so I can't really speak to specific research articles off the top of my head about like what wavelengths they used or what duration or whatnot, but I do know that neurodegenerative diseases in general uh, require pretty high dosages. A because it's the tissues are so deep in the body, whether it's the spine, the spinal cord. Most nerves are pretty darn deep in the body because with dry needling, that's what I'm trying to affect is the nerves.
Mm-hmm.
Um, the brain, you have to get through the skull. So let's say, 7 to 10% of the light actually makes it to your brain. And that means, your dosages have to be pretty long to get a decent dosage to the brain. So in general, they're longer dosages, and it has to be near infrared light because the red light's not going to penetrate deep enough to affect those nerves or those nervous system organs.
Yeah, I've noticed there's a company, Biolight, you probably know them, where they're
Yep.
doing intranasal. I've always wondered whether that's a better route of delivery for red light. I asked Michael Hamblin this. He seemed pretty nonplussed about whether it was any better or not.
What if it's near infrared? Are you saying red or near infrared
I,
intranasally?
I'm not sure. I think the different models have different wavelengths, but I'm not sure what the benefit of doing red over near infrared would be in a situation like that, because obviously you want as much
Right.
penetration as possible. But um, you know, I guess going back to what you said before, I've always pictured a future in sport where when you come off the field and sit on the bench, you have to put some sort of red light therapy device on, and whether that's football, American football, or soccer. I always worry
Right.
about the soccer players because of the way that they head the ball. Surely that's these tiny concussions over and over and over again. Um, so that's possibly something we'll be seeing. And I know there's I can't remember her name, but I think she works with Biolight, and they're working on ex football players and sort of preventing uh, neurodegeneration in them. So seems like pretty fruitful area of research. But you mentioned the gut before. Um, I've been very interested about using red light therapy on the gut, and I did ask Mike Hamlin about this, and he sort of said, "Well, it's not gonna make it deep enough. Like it's not gonna get into the into the intestines."
Sure.
So, but I'm not sure. I don't think anyone's really tested that, or at least I haven't seen that tested. That was just his sort of speculation. Um, but
Is
you
is that due to adiposity, like people having too much adipose tissue, or does he
I
just think in general it
I
wouldn't reach
don't
to?
know. I don't know. I mean, it certainly if you've got a lot of excess adiposity, then the task becomes much greater. Um, I'm very thin, so I was thinking if I put something close to my gut, I don't see why it wouldn't reach that far. But regardless, it might make it, it might not. Does it
Hmm.
have an effect on the microbiome? I hadn't heard that anyone had measured actual changes in the composition of the microbiome following red light therapy.
I believe so. They were on mice models that they were able to
Right.
see uh like an improvement in the ratio of beneficial bacteria to harmful bacteria. And I don't remember if they have measurements for like the oral microbiome. I think there is, but don't quote me on that, where they did see an increase in what is it, Firmicutes to Bacteroidetes or something like that. And
Right.
again, beneficial to harmful, that they did see an improvement.
Yeah, well,
So
I
that's why I
mean,
like using, my oral device on a semi-consistent basis as well, is to help with that side of things, because I'm not sure if you've interviewed or talked to like a biological dentist or a holistic dentist, but
not yet.
the first guest on my podcast was one, Dr. Kelly Blodgett here in the US, and just listening to him outline the implications of your oral health, not just for the sake of your oral cavity, but for your entire body. It blew my mind, and it, kind of changed my mindset on my oral health. Not that I was doing anything wrong, but it's like, wow, I really need to like fine tune my routine, because it impacts your heart, it impacts your gut, it impacts your brain, it impacts everything. And there's actually a post today I saw on Instagram. Someone showed a like a meridian chart and how every tooth or uh, everything relates to a certain tissue or organ. And so it's like, geez, Louise. Uh, so that's why I do red light therapy in my mouth on a semi-consistent basis.
Yeah, I think that's a really fascinating thing to get into because as far as I'm aware, I haven't seen any other companies doing a red light therapy that goes into your mouth and gets onto your teeth, um, which is very interesting to me because teeth are the only like bones that don't have marrow. Um, I was doing some reading before one of my podcasts about red light therapy, and it seems that if you can get to the marrow with red light, you can stimulate these what are called cytokine responses. So basically, um, these molecules get secreted and they can go all over the body to upregulate mitochondrial function. So theoretically, you all you had to do was access the bone marrow somewhere, and you could benefit the whole body. And I thought, oh, I didn't know at the time, but I thought I wonder if teeth have bone marrow because then you could just shine it on the teeth. Turns out they don't have bone marrow, so that was a bit annoying. But um, presumably, red light has because they're bone and because they're you know rich in these um well I might be wrong but teeth are rich in these collagen sort of molecules that sort of keep them nice and strong, and if they're exposed to red light I have no reason to think that that wouldn't be beneficial for them. So um what is this red light doing when you expose your mouth to it?
Well, it's kind of interesting because I don't want to say preponderance, but if you look at all these different segments of red light therapy, hair health and skin health and fat loss and women's health, it's like a lot of the research is in the oral health category because dentists use it a lot. So I guess that's easy access to get some good research done. So to your point, it's kind of interesting. There are more companies trying to figure out ways to integrate red light therapy into your mouth because, gosh darn, there's a lot of research there. Um, Gum health is a big one. I know a lot of people that have, not personally, but like people in general have pretty poor gum health and gum structure where it's like they floss and their gums are constantly bleeding or what have you, gum diseases from chewing and smoking and just poor health habits. Um, there's not a ton of research in these specific areas, but there's some on helping prevent enamel erosion, helping with tooth sensitivity, of course, any type of post-surgical healing it's going to help with. So again, the dentist or the oral surgeons there. And I would argue pre-treating your mouth before surgery would also accelerate, just like in my world of physical therapy. If you can strengthen your quads before going into an ACL or a total knee surgery, you're going to make your recovery much quicker because your quad will be stronger post-surgery than if you weren't to do that. And that's kind of a rate limiting factor is your quad strength. So same thing, if you know you're going to have oral surgery, try to get some consistent red light therapy in, at least a couple of weeks or several weeks or even a couple months before that surgery. So that way your post-surgical healing is likely going to be accelerated. So, and again, we talked about the oral microbiome and the potential implications of that, which kind of runs, systemically. So pretty profound effects there. What else? And I also wonder, I don't think any research has pointed this out. I'm just thinking here, because the enamel erosion, that's an interesting one, isn't it? A lot of enamel erosion has to do with, an acidic environment. And an acidic environment can be secondary to cavities or having bacteria on your teeth, which produce that acid. So anyway, we know that by exposing yourself to light, that is essentially free electrons or bringing in a more alkaline aspect or environment. So you're kind of negating or combating that acidic environment in your mouth. So I just wonder if by doing red light therapy, you're kind of neutralizing that acid by bringing in some alkalinity, so to speak. I don't know. I'm just spitballing there, but and that's how I think of it a lot with the body in general, because a systemically inflammatory body is a very acidic environment for your body. So by doing red light therapy, by modulating inflammation, again, you're kind of reducing the acid exposure, that acidic environment, and bringing it more to a more neutral or basic or alkaline environment, which allows your body to thrive. Yeah, but for oral health, those are the big ones off the top of my head.
Well, it sounds like what you're talking about there is this shift in structure when water is exposed to red light. You mentioned Gerald Pollack before.
Yeah.
So in your mind, I'm not sure there's a whole lot of research looking into this, but water is the most abundant molecule in our body, and it is a red light chromophore, meaning that it does interact with red light. Probably further in the further up in the wavelengths. But do you see a lot of these benefits that are seen from red light therapy through water? Do you think water is one of the main mechanisms by which this is working? We've spoken a lot about mitochondria, which are definitely targets for this red light therapy, but water is one that is probably underappreciated.
It's got to be, right. Yeah, and I remember just from one of the big takeaways I had from Gerald Pollack's book, is it called The Fourth Phase of Water, something like that? Is that in order to structure water, red is better than any other visible wavelength, but infrared or near infrared is best. So the longer you can expose water to near infrared light and the higher the intensity. So the higher the intensity for longer, you're going to structure the water more and more and more. Again, I don't know exactly what the implications are for that and our body via red light therapy, because we've kind of talked about more is not better. So I think there's some interesting interplay there. I think what that book was speaking to is more like if you had a glass of water, if you irradiate it with infrared for a longer duration and a higher intensity, you're going to structure that water. So when you consume it, it's more hydrating and healthy for you. But as far as our body, it's like, yeah, there's got to be, because our body should be full of this fourth phase, this biological water. And one of the end products of mitochondrial respiration or mitochondrial production is not just ATP, which we get focused on because that's, of course, crucial to all of our tissues and organs and cells. But another byproduct is that fourth phase of water. So by having a more functional mitochondria, you're actually going to be producing more of this biological water, which of course is then going to lead to a more hydrated and healthy body. So, but then like to your point, if even just irradiating that water with this red and near infrared light, what are the implications? Well, I got to think they're good.
Yeah, I agree, and I hope more people look into this. Although it seems like a bit of a dicey area to go if you want to make a career as a researcher. So some people are going to have to maybe put their careers on the line a little bit. But yeah, I can't help but think water is a big story in why red light is so beneficial. But why that is precisely, I think we'll have to find out down the track.
Right.
One thing I did want to touch on that you mentioned earlier was thyroid health. Now, to my understanding, the thyroid is an organ that's relatively easy to access with red and near infrared light because of its proximity to the skin. Um, so, what effect is there shining red and near infrared light directly onto the thyroid?
Well, for people deal, and it's just like inflammation. We always hear, or it's always said that like red light therapy reduces inflammation, and well, that's not really true. It modulates it. So that's the beautiful thing about red light therapy is it gives you what you need. If something needs to be increased, it'll increase it. If something needs to be decreased, it decreases it. So really the proper vernacular is it modulates inflammation. That's what red light therapy does is it modulates a bunch of these biological processes again to where your body needs it. So with thyroid health, if it's healthy, well, maybe it's a prophylactic treatment and you'll mitigate or prevent any thyroid issues from coming your way. But if you're dealing with some sort of like Hashimoto's thyroiditis, well, uh, you have some imbalance going on there. And I forget the exact research, but um, red light therapy is based on this research is like one of the only things that it helps people significantly decrease their pharmaceutical intervention, and sometimes people can get completely off of them. You're decreasing the antibody production. Yeah, I'm not a thyroid expert per se. Man, I almost want to kind of look and cheat to give you more specific answers.
Yeah, I mean, it's one of those interesting cases because you can actually reach it quite readily with red light, whereas
Sure.
other things like the kidneys or the liver, you're probably not going to be able to get significant doses in a short period of time. So and I know guys like Jack Kruse say that if you're under artificial blue light, you need to cover up your thyroid because it's actually so close to the surface of the skin that even the blue light can have an effect on it. Now, I'm not sure if that's true, but um, if it's even remotely true, then red and near infrared light are definitely making its way all the way down and having at least interacting with it quite
It's a
intimately.
very radio sensitive organ, right?
Mm.
And that's, to your point, that's probably why it's so superficial. It's so close to the surface. While that's great for red light therapy, I mean, again, if you're surrounded by, these negative uh, wavelengths or otherwise, then it's much easier for it to, cause a detrimental effect.
Mm. And to your point when you were talking about modulating responses, which I think is much more important than just being unidirectional. Um, Red light therapy increases the production of reactive oxygen species in the mitochondria because the mitochondria actually start working a lot more efficiently. So as they churn out more energy, the product is more reactive oxygen species. Um, and that comes back to this melatonin story that I'm sure you're aware of, that paper that goes over. I think it's called Melatonin and the Optics of the Human Body, talking about the action spectrum of melatonin production and why red light upregulates the production of melatonin. And it's precisely because it's this modulator rather than this unidirectional effect. So it's kind of like a what do you call it? An immunomodulator, where if you have an overreactive response, it downregulates it, and vice versa. So
Yeah, and that's like why red light therapy can help with either hyper or hypo uh thalamus issues, or not thalamus, thyroid issues. So there's hyper or hypo, well then it will help decrease or increase as appropriate.
Hmm.
Um, so to your point, I mean, that's a beautiful thing about red light therapy, and I say this all the time, but it's non-invasive, non-pharmaceutical, and it really just gives the body and the cells what it needs to get back to its thriving state, because the body is very resilient. So if you just give it what it needs and uh, uh, needs to operate properly, gosh, you're going to reap the benefits from a health perspective.
Do you have a protocol for skin health? A lot of people would probably be interested in using red light therapy to reduce wrinkles, and make them stay looking younger for longer. Do you have any protocols specifically for that?
Well, I'll tell you what, that's probably the number one reason people use red light therapy is for skin health. I'm pretty sure that's like by far the number one reason. Um, and it's tough to give just a blanket statement on a protocol, because when I develop a protocols, I'm just taking the information I'm seeing in the research, synthesizing the good research to develop the protocols that are in that ebook I've made over the past handful of years. Uh, and what I mean by that is those protocols are essentially a bunch of ingredients thrown together to provide a dosage. And in the end, that's what a person needs to utilize, is that dosage, because all devices aren't created equally. They're going to be emitting different light irradiances, so different light powers, and that's just one of the variables when dictating the dosage. You have the light irradiance, you have the distance you are from that device, because the closer you are, you can increase the light irradiance, so to speak. But then as you get further away, it gets exponentially lower, which can be good or bad depending on what you're trying to do. But again, that's just one variable. And then, of course, the duration of the treatment. And again, that all leads to how many joules is your body being exposed to, or are you absorbing? So in general, again, skin, especially anti-aging skin, is one of the lowest dosage treatments, kind of just like the eye. Let's just say you're using a typical device that has between 100 and 140, 150 milliwatts per centimeter squared, even though that's a decently big range. But whereas I would say a general health and wellness protocol would be, let's say if you're doing the full body, I would do 5 minutes on the front at about 6 to 12 inches away, 5 to 10 or 5 minutes on the back, 6 to 12 inches away, using both red and near infrared light. And I'd kind of call that, you do that 3 to 4 days a week. I think you're going to be doing pretty darn well. You could even say 2 to 4, I guess, depends on the time of the season. Um, Compare that to an anti-aging skin treatment, which would be closer to like 18 to 24 inches away, red light only, and we're talking a minute or two, and like
Hmm.
you're done. The skin's so superficial, it takes a much lower duration. The light doesn't have to pass through any other tissues to get to its target tissue, being the skin. So it's just immediate uh, absorption of those skin cells to get that pro collagen, pro elastin, that anti wrinkle effect. So it takes very little to get that beautiful, plump, healthy looking skin everyone wants via red light therapy.
Yeah, that's fascinating that it's not a big treatment, and the effect is really really tangible.
Well,
Um,
and I think that's kind of anticlimactic for a lot of people, because
yeah,
people get their red light therapy devices. They're so excited. It's like, I want to use this thing. I'm going to do like 5 or 10 or 15 minutes or whatever, and I'm going to do it once a day or twice a day. But it's like, if you're truly looking for that healthy skin, it's like a minute or two. And again, like truly you could do two, three, maybe four treatments a week. I think 2 to 3 would be kind of the sweet spot. But really it takes a little to get what a person's looking for when it comes to anti-aging skin.
yeah, that's really good news. I've probably been using mine a little bit too much then, but like you said, it's probably not going to be damaging. As far as I'm aware, there are no contraindications for
No,
using red light. Is no?
no, not that I'm aware of. And that's the beautiful thing. And that's kind of what I read from Dr. Michael Hamblin. I don't know if you asked him that question, but
I did,
one of
yeah.
the, that's one of the beautiful things about red light therapy is it's extremely safe. So it's a really low risk and a very high reward from a health and wellness perspective. There's some cautions, of course, and a couple of the big ones that get asked all the time is like, especially from females, if they're pregnant or breastfeeding, do you can you still use red light therapy? And the answer is, well, yes, just don't irradiate the areas. Like if you're pregnant, don't irradiate the womb. If you're breastfeeding, don't irradiate the breasts. Not that there's anything to show it's harmful, but we just don't know. So if you have shoulder pain or back pain or leg pain, we'll go ahead and treat those areas, but just don't directly irradiate the areas, the womb or the breast, I guess. And then the other one is cancer. And there's some really interesting research on red light therapy and cancer, because you would think that if it's increased in cellular energy, then maybe it would actually feed the metastasizing cells or what have you. But one of my most recent interviews was actually with in like an alternative or a holistic oncologist, and they actually use red light therapy or near infrared light, because there's some pretty interesting research on how, again, just like we were talking about inflammation and modulates that it increases or decreases it. Well, same thing with cancer cells. It's not going to accelerate the cancer cells or the metastasizing. It's going to there's actually some research showing that near infrared can help mitigate, prevent, or even kill some of those cancer cells. But again, until there's like more and more and a larger body of research, you probably don't need or want to directly irradiate an active cancer site. Uh, but again, if you want to use red light therapy in other areas of your body, then go ahead.
Yeah, that's fascinating. I often wondered, if you had some sort of skin cancer, if it would be beneficial to irradiate it with red light. And yeah, the answer I got from everyone who I asked that was we genuinely don't know, so probably hold off. Probably don't do it
Someone
until
has
we
to do the
know.
research, man. That's a huge looming answer. Like the implications could be huge. Well,
Yeah,
I think
definitely.
regardless of what the answer is, it's huge. It's either you should or you shouldn't. And if you should, then we should probably know that, so we could be, helping some people dealing with cancer if it's
Mm.
truly beneficial.
Yeah, I couldn't agree more. I hope someone's again, I hope someone's putting their career on the line looking into these questions. Um,
They're probably getting shot down by those drug companies.
yeah, probably. I mean, if the answer is something like that, then best of luck.
Yep.
Um, just out of pure curiosity, something that has troubled me, and you might be able to give a really succinct answer, but what is the difference between heat and infrared light? Sometimes I've thought, is having a hot bath or a hot shower going to be supplying any genuine doses of red light in a sense?
Well, so from my understanding, heat is infrared light, isn't it? So like if you turn on your stove or like the campfire again, like if you have on near infrared or infrared goggles, like those things are going to light up like a Christmas tree. So they're
Yeah,
providing some amount of infrared light. But when you start getting into the realm of like a hot bath or like a hot tub, I don't know. I haven't looked into that. That's an interesting question. I mean, I've thought about it too, because I know these other heat sources are providing some semblance of infrared light. I mean, that's what a sauna is. It's providing heat um, via infrared light. So I don't really have an answer for you. It's just that's a good question to ponder.
yeah. I've often wondered if some of the a lot of people feel much better after having a hot shower or a hot bath, and I've often wondered, because you're right, if you put an infrared camera on that, it would be lit up very very light, because it would be emitting a lot of infrared energy. Um, so, and yeah, I was just wondering if that is giving a dose of infrared light, and maybe that's one of the reasons why being nice and cozy in a hot tub makes you feel so good.
Yeah, now you're gonna have me thinking the rest of the day about that. But
It
I know
it
at the
could
end of the day,
just
that warmth is literally improving circulation just by
yeah.
the nature of it, causing some vasodilation and all that good stuff. And of course, that's one of the mechanisms of red and near infrared light. Although I don't know if the water would necessarily be. releasing nitric oxide. Again, I don't know, but I just know from a PT perspective, it's like you throw on a heat pack or you do something, provide some sort of warmth to improve circulation and relax the muscles and all that good stuff. But to your point, is it near infrared or is it infrared light doing it? That's a good question.
Hmm. Yeah, hopefully I
Let me
can,
know.
yeah, hopefully I can get some answers on that. Um, before we wrap up, a lot of people might be interested in getting a device, and it took me quite a long time to bite the bullet and look into buying one of these combination red and near infrared panels. And being so involved the way you are with Biolight, what should people be looking for in a panel? Because without naming any names, there are some brands out there who have excellent marketing, but their product is not superior in any way to much cheaper products. So what should we be looking at?
Yeah, so we touched on one of them, and that's wavelengths. I think in general, you want that 660, 850, and of course there are other uh companies that offer like multiple red and multiple near infrared. I don't know about you, Cameron. I haven't seen any research to show that that does lead to better results, although you could argue that maybe more mitochondria are getting affected by multiple wavelengths. I don't know, but regardless, most most companies have the light correct, so you don't have to worry about that. It's more so the light irradiance you want to look for. To my knowledge, if you want a therapeutic dosage, you want something that's at least above 100 milliwatts per centimeter squared. Um, Up into the 130s. I think once you start going to the 140s, 150s, and beyond, more is not better. And I think there's a misnomer that a higher light irradiance leads to better penetration depth. And the penetration depth is due to the wavelength itself. It's not based on the light irradiance. The light irradiance just means if it's higher, they're getting more photons at a given moment or at a certain depth. That doesn't make it the depth deeper, so to speak. So I think somewhere in between the 100 to 130 milliwatts per centimeter squared is pretty solid for a therapeutic dosage. And I would even argue, I don't know if you've seen our most recent product, Cameron, the mat, which
Mm.
has a since you're going to be basically in direct contact with the LED, the light irradiance is much lower. And part of that is because I think if there's a lower light irradiance, but you're exposed to it for a longer period of time, getting underneath that bell curve is much easier. And the I
Mm.
don't know if you listened to my podcast on it, but the analogy I used is if you're trying to cook something, whether it's on the stove or in the microwave, and you have it on a high temperature, the chances of you hitting the perfect temperature for your food is much lower versus if you do a lower and slower temperature, meaning a lower temperature, but slower. The forgiveness you have of getting underneath that curve is much greater. So I think that's one of the things I'm excited about with that product, the mat. But regardless, 100 to 130 in general, if you're looking at panels, is kind of the sweet spot. And then a couple of things you want to look out for from a safety perspective is the EMF irradiation. I think this is kind of to your point where there's still companies integrating Bluetooth and Wi-Fi, which boggles my mind because I don't know why you need a remote to mess with your panel, because that just adds to the EMF emission and it adds to that non-native light that you're trying to combat with red light therapy. So you want something with EMF that's as low as possible. If it's plugged into electricity, there cannot be zero EMFs. I've seen some companies do this where they say their panels have zero EMFs and they're plugged into electricity. Well, that's impossible because there's going to be some semblance of EMFs from anything that's plugged into electricity. So your laptop or your fridge or there's going to be EMFs if it's plugged into electricity. So anyway, you want that as low as possible. So if the company doesn't list EMFs, you have to be slightly concerned. And then same thing with light flicker. And Biolight, I believe, was the first company to really tackle this issue with just like EMFs. You want to reduce the light flicker as much as possible because just like being under fluorescent lights in an office, if you're exposed to that light flicker, which is invisible to the human eye, but of course our brain is picking up those signals. You don't want to be exposed to that more than you already are. So hopefully they're listing their light flicker so you can see what that's like. So those are the big ones. The Spectra, again, that's usually locked and loaded by most companies. but you really want to look at the light irradiance and then EMF emission and light flicker. And then if people are just wondering what size in general, this is a question I get a lot. If you're just wanting to dip your toes into red light therapy, I don't see anything wrong with getting a handheld device.
Mm-hmm.
At least you get to try red light therapy. Maybe you want to use it on your brain, or you're trying to treat a wound or a smaller issue like the thyroid. And that way you can see if red light therapy really resonates with you. Secondly, if it's a rechargeable device, then it does have zero EMFs and it does have zero light flicker because it's not plugged into electricity. So that can be seen as a pro, I suppose. And then it's very portable. And then you can kind of look up to the next size up, which is more of like a tabletop model, excuse me, where you can treat a larger area, let's say a quarter to a third of your body. But those typically are going to have a higher light irradiance. So if you're looking to treat maybe the brain or things that are deeper, you'll maybe have a more efficient treatment because it has a little more power behind it. And then the next size up typically is like a full body device, which I argue, I know it's quite the investment, but if you look at the research and you've listened to what Cameron and I have talked about and his other podcasts, and you believe in the healing qualities of red light therapy, then I believe that is by far the best bang for your buck. Because just like we talked about, getting systemic exposure, or I should say, getting full body exposure to red light therapy is going to lead to the systemic benefits of modulating inflammation, improving circulation, optimizing mitochondrial health, and everything else that comes along with red light therapy. So those are kind of like the main devices on the market are those types of sizes: the handheld tabletop, which is like the size of a sheet of paper, so to speak, and then a full body device.
Yeah, awesome. That's a really good rundown. I think it took me it took me a long time to sort of work through that because yeah, like I said before, some companies have like great marketing, their websites look great, and then you look at their products and they're no different to other ones that are much cheaper on the market. So um and I know there are a lot of people who have had great results using Biolight. And if the Australian dollar wasn't so bad right now, I would have one being shipped over right now. But yeah,
I
the
hear you. I
shipping
hear you.
the shipping costs to Australia are just ridiculous right now. But one day, and I am very interested in the red light device that goes in your mouth. That seems very interesting to me. And like you said before, um, teeth can be a great cause of disease if they're not treated well. Um, so if we can keep those healthy, that would be fantastic. And like you said, it's you don't need to spend your whole day exposing yourself to red light, which is what's so great about all of this. Um, but before we wrap up, I wanted to ask about any synergistic sort of things that can go along with red light that help to improve. I know there's been a bit of talk about the use of methylene blue and red light at the same time. And I've heard quite a bit about these using things like any sort of chlorophyll rich foods, green tea as well being great combinations to use with red light because of the way that the light molecules interact with their metabolites. Have you heard much about boosting the efficacy of red light with these other compounds?
No, other than what you've alluded to from like a supplemental perspective, but I've never dabbled in methylene blue myself, at least not
Right.
yet. But even just in general with my diet, I do take like some organic chlorella, organic is it spirulina
Yeah.
daily, so I'm getting that on a consistent basis, and if that helps with red light or sunlight exposure, then great. But as far as like other modalities, I'm aware of the vibrational plate is good because vibration is good for the mitochondria.
Right.
Hyperbaric oxygen. I interviewed the guy that owns the kind of the biggest hyperbaric chamber company in the States, Dr. Jason Sommers, and he also has a book out that's very well written. But he and I went back and forth like which order is best. We know that there's a very nice synergistic effect with hyperbaric oxygen and red light therapy, but like which order? Because hyperbaric kind of leads to vasoconstriction, even though it improves oxygenation into your body, which is um, kind of backwards, it would seem. But And then, of course, red light therapy causes that vasodilation. So you don't want to vasodilate before and then kind of constrict in the hyperbaric, or do you want to go backwards and oxygenate and constrict in the hyperbaric and then open up and energize post? So I don't know. We went back and forth on that, but I think he and I, in the end, it was just like, as long as you do them together, you're probably going to get a good result. So we're probably talking maybe a nuanced difference. And then the other one is like cryotherapy or I would jump in the river over here where I live close, nice and cold. Just like you could do that with a sauna and kind of, again, get that vasoconstriction dilation, kind of get that pumping mechanism. Same thing with red light therapy. You could do one before, let's say, do cryotherapy, then red light therapy. And then you could do all three if you had access to. You could do like hyperbaric, red light therapy, cryo, but then it's like, what else are you going to do with the rest of your day if you're doing all these biohacks? So there's those. Another one just based on the Ari Wooden book, like if you're looking to lose weight or lose some fat, combining fasting with red light therapy, and then the best bang for your buck would be fasting plus exercise and red light therapy for some mega fat loss type of things. And then, of course, there's a bunch of other adjuvants and supplements you could add in for mitochondrial health, like astaxanthin and carnosine, spermidine, fisetin, curcumin, all these other components that would boost mitochondrial health from a molecular standpoint, I think would probably lead to a synergistic effect. But the big ones that I know of are the vibrational plate, HBOT, cryotherapy, and then, fasting and exercise if you're looking for some weight loss.
That's fascinating. Yeah, a lot of the places, or at least the place where I go and do sauna somewhat infrequently, they have hyperbaric oxygen as well. I haven't tried it yet, but might be something to look into.
Yeah.
Yeah, awesome. I won't keep you any longer because I know you're probably really busy. And I will make sure I put links to the Biolight shop and the Red Light Report so that everyone can sort of keep up with you. I really love the podcast. It's just a great way to keep up to date with all things red light. And your ebook has been very helpful as well, that you continually update as the years go on. So I'll make sure I link all of that so people can keep in touch with you. Thanks so much for taking some time to speak with me today. It's been great.
Yeah, my pleasure, Cameron. It's been a blast, conversing with someone else who's as, interested and well versed in red light therapy. So, my pleasure.
Awesome. All right. I'll talk to you soon then. We'll keep in touch.
Definitely. Sounds good.
All right. Thanks, Mike.
Cheers.
Thank you so much for listening to this episode. I really hope you enjoyed it. If you'd like to keep up with Mike's work, I've put some links in the episode notes. If you'd like to support the podcast, you can subscribe on Spotify and YouTube and leave up to a 5-star review on Apple Podcasts. This is a simple, no-cost way to support my work and help me reach more listeners. Please feel free to leave comments on my YouTube channel, as I do try and read through as many as I can. I've also put links to all of my social media platforms in the episode notes if you'd like to keep up to date with the podcast, get information about health, or if you'd just like to reach out to me in general. Thanks again for listening, everyone. Take care.